as busy and as intense and as dense as New York is, in some ways, I think the only way to really manage it is by appreciating the relationships that you have with everyone around you.
Welcome to another episode of The Force for Good. I'm Rick Gertsema, the Senior Mental Health Advisor for Archimind Global Institute for Mental Health Solutions, and also the Senior Mental Health Advisor for the Miller-Dwan Foundation. Since this is Mental Health Awareness Month, what we decided to do for today's podcast is bring together the executive team for Archimind. And so joining me today is Traci Marciniak. She is the president of the Miller-Dwan Foundation and also the CEO of Archimind. And also joining us today, Dr. Adam Brown, who is a professor of psychology at the New School for Social Research in New York City. So what I'd like to start with today is we were talking about a podcast for Mental Health Awareness Month and thinking what could be a message that each of us could give to our listening audience from a CEO perspective, from a professor perspective, and somebody who has a lot of experience in global mental health. And so what we landed on is this whole idea about healing does not need to be complicated. So as we talked about that, Traci, I'll start with you, and then Adam, I'll ask you. How did that resonate for you personally and professionally when you think about healing does not need to be complicated?
Good question, Rick, and thanks for having me. I think sometimes the concept of needing to ask for help and knowing that you need to take some steps to actually be a healthier individual can be a little scary.
Sure.
So when we think about it not being complicated, there are certain things that people can do in their lives that aren't that scary, that really do have a pretty good impact on their mental well-being and their overall health.
Sure. And so when you think of that conceptually, you're thinking about not only just your professional life, but also your personal life. And in both areas, it doesn't really need to be complicated.
Right, exactly. So, when I think about myself personally, several years ago, I was at a point in my life where I really felt like I had lost control. I didn't necessarily have control, and it was really manifesting itself in, really some depression, some anger, some unhappiness.
Yeah.
And it seems so simple, but I started to exercise. So I would wake up earlier in the morning.
Sure.
And I would exercise before I went to work.
Got it.
And it made a tremendous impact on how I felt.
Nice.
And, since that time, I continued to have that habit.
Sure.
And, it's interesting, though, now that I've become so used to it and it's part of my routine, that if I don't do that, I can definitely tell the difference in my own self. I describe it as I feel like I'm in a funk. And I don't know. And I know everyone hears, exercise is really good for you, not only physically, but mentally. But I can attest to the fact that it made a huge difference for me because it allowed me to have control over something and at the same time made me feel like I had some power.
Right. So then thinking about that, the whole concept of it doesn't need to be complicated. It just needed to be a step that you were taking in a direction.
Exactly like that. And, there's something to be said for routine. I'm the type of person that a routine is very helpful for me. I don't like surprises. I don't like things not being planned out. I know in life we can't always do that, but I do make a real intentional choice to try to make a plan for my week, for my day, whatever, because that really eliminates anxiety and stress for me if I know what I'm going to do, when I'm going to do it, with who I'm going to do it. And that's made a huge difference in, my levels of anxiety.
Sure. And Adam, I would ask you basically the same question. As we were having this whole discussion about healing does not need to be complicated, what resonated with you both personally and professionally?
Thank you, Rick, for having me as well. And Tracy, thank you for being so open and vulnerable and sharing your own experience around your well being and strategies that you took to manage some of those feelings. Before I answer, I just want to, call out that I think for Mental Health Awareness Month, it's so important that we have dialogue and openness around our own trajectories and relationships with mental health. When we, began talking about this topic, I think for me, two things really stood out. It was sometimes healing is complicated. Sometimes people do go through things that take a long time to overcome and to process and to move through. But there's also a lot of research that people find ways to adapt to even some of life's greatest challenges and uncertainties.
Sure.
When you look at the literature, when you look at research, it's interesting how consistently these things are not overly complicated, sophisticated things, but they are quite simple. And one of the most powerful things that we see again and again is social support, but not having thousands of friends or followers on social media. It's what
Yeah.
we call instrumental or reciprocal support. Having someone in your life that will give you a ride, cook you a meal, fix that thing in your house, or where you can do that for someone else. That sort of bi directional, let me show up for you consistently is one of the most important predictors of resilience and overcoming adversity. And in addition to that, if you look across different kinds of therapy, different kinds of mental health strategies, again and again, there's a few key ingredients that, when they're present, that's really what helps people to get through those tough times, like empathy, a sense of hope, as Tracy said, getting back to work and back into a good routine, and maybe developing some good emotion regulation strategies, whether that's physical exercise, good sleep routines, things like that. So while these things are very powerful, at the end of the day, they're also not necessarily that complicated. We just have to be aware of them.
And I like the phrase, even in research, and I appreciate that you're bringing in the whole research area. That this is not necessarily something that is just a self-help book, but there is research to substantiate the importance of reciprocal relationships, and I think that's one of the things that, even as we have learned to work together as a team, that whole give and take and that reciprocating, I think, does create a sense of connection, and connectedness to one another, right?
Agreed.
Yeah. And so, Tracy, when you talk about those the power of small habits,
Mhm.
to me, exercise can seem like that's a big habit to jump into.
Right.
So, for our listeners, if you think about what would be some small steps or some small things that you can do really to create a small consistent habit, what would that look like for you?
Yeah, that's a good point. Everyone's version of exercise could be defined differently. I like really high intensity sort of exercise,
Exactly.
but I know a lot of people really use yoga as a way to be able to, find some mindfulness in their day. So I think, when we think about habits, observational research shows that having healthy habits helps people's health.
Okay.
So, when we think about how do you start a habit, I think they say you need to do something, what I've heard, anywhere from 7 times to 66 times to create a habit.
Okay.
But let's hope it's not
Not 66.
66.
Yeah, thank you.
But you have to be intentional about it. And, I mentioned earlier that I started getting up early in the morning.
Yep.
Not everyone's favorite thing to do, but I knew that that was the only time, if I wanted to start doing something, that was the time that I had to do it, because
Right.
the rest of my day was full. So when you think about starting that new habit, be intentional about it. And you don't have to do something big, so maybe it's you get up and you stretch for 5 minutes, and then extend that out.
Okay.
So I really think that, having the intention of doing it taking the step to do it and then being committed to doing it. And let's face it, everyone's going to miss a day or forget to do something they're supposed to do. Don't beat yourself up about it because that happens. Life gets in the way. We all
Sure.
know that. But if you are really trying to, make yourself better, make yourself more mentally healthy, then commit to it, be easy on yourself, and just go for it.
And Adam, you talked about the importance of reciprocating and even doing small things in thinking about your world. We're talking New York City, for Pete's sake. Your incredibly busy schedule. When you think about that reciprocating and what that could feel like in a day-to-day sort of simple way, how would you offer our listeners ways to go ahead and start thinking about some of those reciprocal
Mhm.
things?
So, Rick, as you said, I live in a busy city and I'm a very busy person.
Yes.
One of the things that I can just build on to what Tracy said was I think habits are so important. I think we really do underestimate the power of micro habits to transform our well-being
Oh,
and our overall physical health. I
yeah.
wish I wrote this book. I didn't, but there was a very popular book written a few years ago called Atomic Habits. And the author talks about a few really simple things that you can do to kickstart a habit. One is habit stacking. So if there's something that you do every day, could you add one small thing on top of that habit that might be good for you? So perhaps while you're making your coffee in the morning, maybe you do a few jumping jacks while the coffee is brewing. So you're not
Jumping
necessarily
jacks
taking
and coffee.
all that time to get to the gym or the yoga studio. Maybe you're busy
Sure.
like me in New York and you're caregiving and you're getting ready for work and you're getting text
Exactly.
messages from work. You're doing all of that, but you've got a few minutes. So, how do you stack those habits? But those small things can make a huge difference. The other is to take things that you have to do. And to add something that you want to do and combine them together. So if there's something that you really want to
Oh,
do, that's easy.
yep.
Let's say there's something on television you want to watch later that evening. You're going to
Yep.
do that because you're intrinsically motivated. But perhaps before you watch that show, you add something like a little bit of a physical health exercise or something else that's good for you right before that. And then you get the reward of the television show after. So I think it's about people
Sure.
taking that moment to think creatively about those moments in the day where you have a decision you can make. And
Yep.
if you can just spend a few extra minutes using time to work for you instead of against you, I think the other really interesting thing about that book is that you don't see the benefits right away. We know this.
Oh,
It's
sure,
like
sure.
it's
That
taking
we don't want people to be thinking there's going to be an immediate, okay,
no.
you've done this once or twice, and now you're good to
And
go.
that's right. And the other example that they give in the book is you don't feel or notice the difference right away. It's like if you were to get, onto an airplane taking it to New York, but the pilot just altered the direction a little bit. At the beginning of the flight, you're not going to notice any difference. But by the time you land, you're in a completely different city. And I think the same is true with atomic habits, where these small
Uh,
things over time begin to accumulate and you see the magnification effect. In
sure.
terms of New York and the relational aspects, as busy and as intense and as dense as New York is, in some ways, I think the only way to really manage it is by appreciating the relationships that you have with everyone around you. And one very simple thing that I like to do is before bed, especially if I have a million things running through my head and it's hard to compartmentalize and, decompress, I'll just take out some paper, I'll take out my phone, and I'll think about three good things that happened that day.
Oh, nice. Gratitude.
Really, really simple. But not
Yeah.
just, good things. I try to embed them into relationships who are
Sure.
three people that over the course of the day, if they hadn't said something, introduced me to an idea, or stepped up to help me navigate something, my day would have been quite different. And so just that simple, as Tracy said before, sort of intentional act of thinking about three relationships and interactions that I've had throughout the day that if that didn't happen, my mood would be different. I would feel more stressed. But taking that time to just appreciate those relationships and the qualities and the
Sure.
goodness of those connections seems to really help to bring down stress levels.
Yeah, and I love the idea of writing down the names of people or the names of things that could have occurred during the day. And to Tracy's point, when you think about exercising in the morning or before you go to bed at night and you have an expression of gratitude, um, really thinking about we're all on a different clock, and we're going to be more aware or more alert or more willing to start a new habit or write down anything. It could be different for different people. Yeah, and I appreciate that. And Adam, to your point about even as busy as New York City can be, all the way to life in Duluth, Minnesota, it really is trying to create this mindset first and foremost that um, we really do, we really can create some sense of health in simple ways. It doesn't need to be complicated. You agree with that?
Absolutely.
Yeah.
Yes. And I think that, you know, thinking about you and your professional life and the number of kids that you've served over the years, sometimes I'm sure you've heard from them some of the simplest things have made the biggest impact in their healing.
Exactly.
So, taking it all the way to that clinician perspective, I
Right.
think it's we all have to find time, and we all deserve it for ourselves to be able to carve out that time to be able to create that habit, do something that makes you feel good, do something that brings you joy. And when people are, they say they're too busy or whatever the case may be, we owe it to ourselves to treat ourselves well. Think about how you treat other people,
Right.
and the compassion that you have for them, the help that you provide others. It is okay to do that for yourself, and
Right.
in fact you have to in order to keep yourself well.
Sure. And Adam, maybe from more of a global perspective, and certainly as we've been doing work at Archimind, and we have talked about training non-specialists or lay people in order to deliver an intervention like Problem Management Plus. From your perspective, when we talk about Problem Management Plus, PM Plus, one of the very first things we talk about is mindful breathing, right? So managing stress, managing problems, and would you agree that part of what the mission would be is to try to make taking care of yourself, taking care of your mental health, not have to be so difficult?
I think that's exactly right. I think part of the beauty of some of these scalable mental health interventions is that the data shows that we can kickstart some really positive coping skills that people can use to not only manage whatever challenges they're facing now, but they can continue to come back to these strategies, whether they're facing something bigger or something smaller throughout their day. But
Right.
again and again, we see these things like, slow breathing, being able to take apart big things and break them into smaller, concrete, identifiable things that we're trying to manage,
Yes.
social support, a sense of hope and optimism. These are things that hopefully we carry with us and that we can teach other people. The other
Right.
thing that I think is so important, back to this idea of relationships, in some ways we could just give out booklets and say, here's all the things we want you to learn in PM Plus, and just
Right.
use them. But we know from so many years of psychotherapy research, we know from so many years of anyone who's been studying mental health outcomes, that there is something incredibly powerful about the relationship between the provider and the recipient of that care.
Agree.
And so there is an alliance. There is something so powerful that's formed, whether it's a clinician, whether it's a faith based leader, whether it's an after school programmer. But the person who's providing that support develops such a unique relationship to the person receiving that strategy that in and of itself, that relationship becomes one of the pieces of what's so powerful about PM Plus.
Right. And I love you bring up the point of the importance of relationships. It's relationship with self. I mean, thinking about we need to take care of us and we deserve to take time out for ourselves, all the way to a global perspective and the impact that PM Plus can have because of a relationship and a relationship that's established. The other thing that I think about with PM Plus specifically is that we're not saying we're going to teach somebody how to solve problems or to solve stress. And so to me, when I think about healing does not need to be complicated, it's really taking those smaller steps and not making it complicated by language or by lingo or that it has to be therapy. Certainly as a clinician, I would say if somebody really wanted to get involved in therapy, great. And there might be a different way to try to help mental health care not be so complicated. And I think that's part of our mission when we think about Archimind.
Yes, absolutely. To make care and support more easily accessible for people and less scary can have a huge impact. And when we think about PM Plus and the fact that we're able to train people in community and they're able to serve people within their own community with whom there's already a relationship or a comfort level, that goes a long way towards having people get what they need. Because we all know that there's people who don't want to approach the health system. They don't feel comfortable for whatever reason, but they will approach a trusted friend within their community, someone maybe within their church, someone within another social organization that they're part of.
Right.
And that's the way that we're going to be able to get help into the community in a way that it's never been before.
Right. And I think maybe for both of you, the role of environment in making sure that healing, it doesn't have to be complicated. So Adam, I think that you've talked about that just a little bit, but could you speak to the role of environment, especially, and we'll talk about the different contexts from all the way from New York to Duluth, Minnesota.
I think context cannot be underestimated when it comes to how we think about care. I think for too long, we've only imagined care happening within hospitals, medical centers, clinical type offices with sound machines outside the doors. And that's absolutely fine. But I think we also need to think creatively and a little bit more openly about where people are and how do we meet them in their context, where people work, where people live, as a way to reach more people. And, I think that's going to be critical both for overcoming the barriers that come with being busy and may not have the resources or time to get to certain appointments. And in addition, I think to combat stigma, we can do a lot by training people to support others within the contexts and communities in which they feel safest and most comfortable and where they already have their strong support networks in place.
And that, once again, the reciprocal nature, sure. Traci, context, as Adam talking about, when we really think about contextual, that what's the context in which we all live and interact? You can put your spin on that as well.
Right. Well, and when you talked about PM Plus, too, that comfort level of being in an environment where people, you trust people, can have a really big impact. And, I think about some of the work that the foundation has done over the years with respect to physical environment in care settings. And, we know that the research shows that certain environments, particularly within behavioral health care, have a huge impact on the outcomes of the patients in those spaces.
Right.
But I think, Adam's correct in the sense of, that reciprocal reciprocal sort of relationship, sometimes when I think about environment, I think about who I'm surrounded by.
Oh, nice.
And, I think we've all heard this: surround yourself with people you want to be like, or who, drive some sort of, passion or invention in you. And I think that speaks a lot. And, we're lucky at Archimind and Miller-Dwan Foundation that we have a team of people who actually give everyone else what they need in order to be successful. So, if you're not lucky enough to have that in your work life,
Right.
hopefully your family life or your chosen family can also provide that level of stability and strength and the desire to be better and healthy, to really, be good with the people around you.
Sure. Adam, as you think about wrapping up a bit with what would you want our listeners to walk away with? One or two takeaways for Mental Health Awareness Month. It does not need to be complicated. What would you like to offer?
One, I think we need to remind ourselves that there are a lot of people throughout the world who are struggling with mental health concerns.
Correct.
And unfortunately, in so much of the world, the amount of funding that goes towards people's mental health is at the very bottom, of budgets. Usually,
Sure.
maybe 1% is being spent on mental health, and then even less of that is being spent on community-based forms of care.
Right.
So for Mental Health Awareness Month, I think it's important that we all commit ourselves to trying to think creatively and differently about new models of care and support, while there's so many challenging things that people are facing across the lifespan.
Right.
And just to add to that, from this theme of it doesn't have to be complicated, I would take a moment to think about, who are 3 people in your life that, if you were going through a rough day, who can you reach out to for some of that instrumental support? Who can give you that ride? Who can make you that meal? Who can make that phone call for you?
Right.
And who can you do that for? I'd love everyone to just send a text, pick up the phone and say, hey, it's Mental Health Awareness Month. I just want you to know that I've got your back. I'm here for you. I may not be able to be your therapist, but if there's anything I can do practically for you, I don't want you to hesitate. Just reach out to me. And if I can do it, I will do it. And I think just getting into that sort of practice, I think this is a good month to try out some of those things.
Right. And giving back to others. So that, the power of sending a text message, the power of checking in with somebody at the end of a day or the beginning of a day, and that thinking of 3 people. I love that. Traci?
Yeah, I think probably my advice would be kind to yourself.
Nice.
And, as someone who historically has been very self-critical of themselves, very, very hard on themselves, I've had to be intentional about that, being kind to myself and, really thinking about some days I do the best I can, some days, are better than others,
Right.
but to not get into that do loop of, oh gosh, I should have done something differently, or I should have been better at this. We're all human. We all make mistakes. We all do great things. We all do some not so great things. So it's really about looking inward and, being okay with yourself, being kind to yourself, and knowing that if there's something that you want to change, you can do it. But maybe you just need to start small and you need to take those incremental steps and you need to be intentional about it.
Love it. You both have just been absolutely incredible. And it's really the reason that we wanted to bring this topic forward. Is it doesn't need to be complicated. And for those of you who are listening, really thinking about this month, and I like Adam's challenge to think about reaching out. Do something just a little different. Try something that's simple. It doesn't need to be major, great big steps. Take the small steps. That's actually part of being the force for good and why we invite people in. So thank you for everybody, to everybody for listening. Check us out on all the socials. And once again, thank you for being with us in the Force for Good. And you can join us in being the Force for Good.